those of you who've been here before, if you missed the other two, I really recommend going back and listening to it. This has just been a really good series. It's always dangerous to do series because, you know, you start strong and they can always end the wrong way sometimes, but this has just not been the case with this one. And the feedback I've gotten personally, emails I've been getting, people who I talk on the phone and they say, I saw that, has been really good. So this is obviously a topic that people are very interested in. And we obviously have the right panelists too, because the feedback has just really been positive. So the goal of today really is really to kind of wrap it up with what I think is probably, it might have been the first question, but I think we had to build to it. And that is, you know, how do you make it in this business? How do you know, what are the landmines? Where should you not step if you're doing this for the first time? And what are the challenges that you better be able to deal with, or at least be aware of going into it? And so I am going to ask all of the panelists to do that. You know, the second question I had intended to ask was how do you make money at it? Because that's probably the first question I get. After, you know, should I buy my supply or equipment first? The next one is how do I make any money at it? You know, people go into this I've talked to enough hygienists, independent hygienists, to know that people go into it for different reasons. And it isn't always the money, but there has to be a reward that is meaningful. Otherwise, you wouldn't be doing it. Why would you take this risk and put yourself on the line, put your dollars on the line, put your time on the line, if there wasn't a good enough reward for it? And some of that should be money. And I think Kathy had mentioned that it needs to be sustainable. Otherwise, why would you do it at all? And so I'm going to ask each of those to talk about, each of the panelists to talk about, to wind it in. And maybe the two aren't all that different. Maybe that the biggest challenge is the sustainability. But I am going to start with you, Kathy, and put you on the spot. And I will ask, you know, what was your biggest challenge? But I would like you to tie that into landmines potentially that you'd suggest people look out for. And then also how to get to sustainability or actually even make money on it.
That kind of all kind of part and parcel, I guess, for me. So the hardest part of any business is getting the business, getting the contracts, selling a product, whatever it is that you're doing, that's the hardest part. The idea is not the hardest. You know your skills. There are lots of online, you know, we're resources to help you do the background, which is, you know, the state board and the permitting and all that. I mean, there's a lot of self-directed education that has to go into that first. You have to be prepared to know what your state laws are above anything else. And then work at it, you know, just work at it. But I think the biggest thing to do is, before you spend a whole bunch of time and money, is go out and canvas who you think your potential clients would be, and see what the need is in your community, and decide how far you're willing to travel. And like any business, it starts small, and then you add on and figure out, well, you know what, there's been so many light bulb moments for me when I'm like, well, that didn't work out at all. So I'm not going to do that, or I'll do very little of that and move towards this other thing, you know. And then there's always the constrictions of how much physical time you have to devote to these things. So again, start small. Go to one place or a couple of places, go with your business card and introduce yourself and say, is this something that you'd be interested in? For me, one of the big things that I learned was, just because I want to do this, and just because there's a facility or an organization, whether it's a church, whether it's low-income housing, whether it's any type of an organization, and they want to do it, does not mean that the people are going to show up. It's very frustrating because there's a lot of equipment. I can't tell you how many times that has happened. So just this week, you know, I mean, I had a facility who told me that they had 15 to 20 patients to see. So I booked 2 days. And then last week, I'm like, listen, I need all the information so I can build records for these people. And they came up with 6 people. And I can't tell you how many times I've walked that trail. And unless, and I told this person, I said, listen, you told me there were 15 to 20 people. So if it doesn't work for both of us, it's just not going to work. I'm going to go and see these people this time because they're expecting me. But if you want me to come back, there has to be, there has to be responsibility on both sides, I guess is what, and don't feel bad about doing that. You're not going to go in and set up all your equipment for 2 people. You just can't. You can't do it. Those people would be better off going to a local dentist. So, I think those kind of conversations need to be had. And I think that's the biggest downfall that I have had to walk through. Even if you think it's a big account, sometimes it's really not. And then other times you think, well, I won't have a lot of people here. I'm booked the whole time. It really depends on the facility and how well they're willing to work with you. Are they willing to call those patients and remind them of their appointments? Are they willing to book your schedule? Because for them, this is my last sentence, but for them, they have a job in that they have to bring services into the facility. So their box has been checked. They don't really care whether people come and you're successful. Their job was to bring services, and they've checked their box. They've done their job, but you have to make it their job to make sure people actually come.
But just before we came on, Kathy, we're talking about diversifying who it is that you treat. Can you talk a little bit to that?
Well, I think like even in a dental office, if you're unless you're a specialist, if you're expecting like, I'm only going to see people between 25 and 45, or, you're limiting your patient base, and you're not going to be successful. So I think that you have to open your mind to say, well, maybe I can do nursing home care. I'd like to do, we'll try to do some assisted living facilities or Alzheimer's units. So find out what it is your community needs. That's really what it comes down to. Where do you fit within your own community? I worked with a hygienist once who said, well, I want to see diabetic patients. I want to counsel them. And I thought, well, that's pretty narrow and pretty slim. So good luck. I don't think I can help you unless you get in with a medical facility, and it's really not, you're probably not going to make it on their payroll, because they're not going to pay for dental hygiene education. They pay for dietary education, but they're not going to pay for dental hygiene education. I would think. Maybe it's different. Maybe you can wheedle your way into, a medical practice. And I think there should be a hygienist in every medical practice, in every pediatrician's practice, educating the parents, But that's another thing I've done. I've gone to the pediatricians and I've set up, oral hygiene clinics on the weekends, doing sealants, fluoride, and education for the parents. And it's been wonderful. That was really a really fun, nice program. So there's lots of different places that you can provide services. Just find out what it is that your community needs.
Great. So I'm going to come back to you to ask you in a few minutes about your patient base and what kind of, is it all fee for service? Do you work with insurances? Do you work with grant funds and so forth? But I'm going to ask Jolene just to tell us a little bit about, again, some of the pitfalls and any advice that you want to give as we wrap up this series. You're on mute, Julie.
There we go. Thank you. Kind of to piggyback on Kathy, that I feel like knowing your state laws very, very important, because that could pose some pitfalls down the road. And I thought I was pretty familiar with mine, but I had to make some last minute adjustments and make sure that, I was following everything. I mean, I'm not going to go through having a business and then put my license on the line. And I'm sure any hygienist that's thinking and considering mobile dentistry as a business, needs to be very cautious and, do their homework on that. But getting up and running, again, it's kind of the same things that I have a lot of facilities that are saying, yes, we want your services, but then they're having trouble, booking, and in the beginning it was like, oh, everybody wasn't vaccinated, and then they had some extra breakouts, and then they were signing on new people that weren't during COVID, and now we're just kind of starting to get into the care side of it. But I do like Kathy's advice too, to say, hey, in order for me to come out, there has to be a minimum amount of patients, and I'm going to add that into my contract because I like it, and go with that. I also have done, some other things like offering screenings for their residents because that helps the facility with their state visits. And so I am looking into signing up for 2 types of insurance right now that through the American Mobile Dental Alliance. Many members have these 2 types of insurance and it works well for them. So I'm exploring different things. Corporate dentistry, I tried one of those and I really enjoyed it, and I'm very open to that and going to market in that direction and partner when it's possible for that, and just being open to different things. So initially my focus was assisted living and skilled nursing, but I think I need to be much more open and to the opportunities that would be out there.
What can you clarify what corporate dentistry is in your definition?
Oh, okay. So you have my picture of my setup, and it was myself and another hygienist. So it was a corporation in Miami, and they brought us in and we set up in a conference room, and we had 2 different chairs. And so we ran kind of a simultaneous dental hygiene clinic, and, did all of our services. So we did x-rays, intraoral pictures, dental cleanings, and whitening treatments. And it was really a lot of fun. It was some busy days, and they were committed to so many patients, and the patients were great to work with and had a lot of fun with it. So the reason why the corporation did it was because they knew that their employees hadn't been in for over a year, and they knew that they all needed dental cleaning. So they thought it would be more convenient and a better use of their time if they could just go up the elevator and come to our little portable equipment and have it right in their facility, rather than taking off, going to a dental office and taking like a half day off work. So it worked really well. We did a couple referrals, found things that were kind of considered emergencies like infections and that, but the patients were really good and receptive to it, and they want to do it again in 3 to 6 months.
And that's how you build a name for yourself. People like, oh, I did that last time. It was really great, because there are always people that naturally will be firsts. They're willing to try anything,
Yeah,
that's
okay.
just their personality. You just, oh yeah, I'll give that a shot. And then they will talk it up if they had a great experience. And then before you know it, so sometimes having a minimum amount of people, it's okay if you think you're going to go in there, try it for 6 months. Then if it doesn't pick up, then you have to pivot and say, well, that's not working. It's not worth my time.
Okay.
So I guess it's always reevaluating and pivoting when you have to.
Okay.
I am going to come back and ask you more about the corporate stuff, because I think we've had some experience. We have a number of customers that do this, and I think maybe you might have, Jolene, actually worked with one of them at Flossbar in doing this. I think there's a huge interest there. We've personally seen people pick up as many as 30 and 40 patients very quickly if you go into a place, an employer group, depending on the demographic of the employees. And so I am going to come back and ask a little bit more about that, because I think that there is a gold mine there for where people can do that. But Joan, I'm going to move to you right now and see what final things you have to say in terms of advice and landmines and obstacles.
Right. I'm definitely piggybacking off of Kathy and Jolene here and the way the conversation is going. I've got my earphones on because I'm actually visiting my daughter in Virginia Beach, and I'll have the Top Gun jets coming over me. So I wanted to make sure that didn't happen. But yes, I wrote those three words down: risk, reward, and sustainability, and kind of weaving them into the notes that I made for today's webinar was that there is something organic about what you do once you've set all the things up. And we really spoke about that in the first two episodes. But I think that we have to pivot sometimes and look at what happened. Now, we had the greatest pivot of them all, and it was called COVID. And certainly affected my my demographic because it is with the homebound. And many of my patients were living in congregate living. And so I wasn't, as a vendor, I wasn't allowed to come in. So it gave me an opportunity. I called it my COVID sabbatical. And it gave me an opportunity to really take a look at what it was that I was doing, what was successful and what wasn't successful, because I've been doing this since 2014. And one of them was revenue, you know, steady revenue and steady patients. And that was one thing, but the other thing was outcomes, because I was reading and reviewing the studies that were coming out on how much oral health was equated with COVID, the challenges there, and also the challenges with Alzheimer's disease, especially, and inflammatory markers. So I'm looking at a completely different way of delivering care. Instead of to people that want to have care with me, it's actually to going in to the whole facility. And as Jolene said, go in and do assessments. I'm very much into the medical dental integration piece. Mm-hmm. So that's really important to me, as is research important to me. And I am going to be starting with a HRSA grant, a site for a HRSA grant with the Harvard School of Dental Medicine. And so I'm really interested in actually changing the game, like changing the way that we work. And I do think it takes innovators like us. It absolutely does. We are the catalyst, if you will. We're the movers that, you know, move us forward. We're the fearless, if they say, you know, as they say. But I really think that there are lots of ways, you know, things that they're looking at now. The latest study came out. It was a Medicare study. And they proved that access to preventive oral health care and emergent care, which would be, you know, endo or extractions, reduce the overall Medicare medical costs by $200 or $300. So it is significant. And I think that we just need to start to make structural change, have it come from everywhere. And then as we go out and move out. So I'm looking at a completely different way of delivering my services as a result.
Well, and getting into the financial stuff that I was talking about before, and you had mentioned just as we were coming on, as everybody else is joining, that you're looking at what I call concierge, but you were saying membership model with the people.
Yes. Mm-hmm.
Can you talk a little to that?
Sure. Well, I guess it's payment models, you know, and some of the models that are happening in third-party payer systems are looking at different payer groupings and payer systems. But for me, in a small business that I have, making the impact I want to make, during COVID, I took hours and hours and hours of continuing education. Did you, Jolene and Kathy, both? I mean, I just tried to get a hold of learning everything I could. And one of them, I was introduced to a company called Clear, and they develop a membership program. So it's for people that are uninsured. And that's mostly everyone in assisted living that I know. I mean, now they're starting to have more access to other payer systems. But this one just allowed me to really tailor that comprehensive assessment, because I want to definitely go more into supporting the nursing care plans and the inflammatory markers and things like that. So it's a set price for their preventive services, and it's paid monthly or yearly per resident. And with the contracts that I'm going for this is going to be every one of your residents. Because one of the things that I have seen in my experience over the last 6 years is the amount that residents are paying for custodial care is horrendous to not have an oral health component in there. So Kathy really stimulated me last time when she said, you got to have the mano a mano, they got to have some skin in the game. And so that's really, and I thank you for that, Kathy, because I was just saying, I can't continue to do what I did. I was building my business, but I wasn't even taking a salary. So I said that something has to change. And that was the big change agent for me.
So Kathy, again, I was going to ask you about your patient mix and where do your revenues come from? Is it all fee for service? Is it insurance?
No, it's a little bit of everything. And I think that's kind of the key, I mean, I think if you're focusing on one particular thing, you're probably going to get down the drain. In Massachusetts, I can bill to Mass Health, which is the state Medicaid program, and it does cover senior citizens, adults, and children. Not, they might have just the medical portion and not the dental portion. Then there's also a couple of senior programs called Commonwealth Care and Senior Whole Health that people belong to, that we're able to bill directly to. Of course, those are Medicaid programs, and so the reimbursement rates are very low. And, it's still more than you're making in the private dental office. There's a caveat with that. It's more money, but you're spending more time. And I mean, once your equipment is paid for, okay, I get it, but you are spending more time. I've spent a lot of time today doing billing. I mean, and I could hire someone to do that, or I could do it through a, web portal, or, I mean, there are other ways to do that. So some of my insurance is I can bill directly. I have a relationship in 10 nursing homes with the dentist of record at those nursing homes. And so if it's private pay, excuse me, if it's private insurance like United Healthcare or something that I'm not able to bill out for, he will bill that out for me. He takes a small percentage for administrative fee, but we're sharing the same patient. So it's not like I'm asking the doctor down the street to bill out for all my patients that he's never seen before, because I believe that would probably be insurance fraud. He actually sees these patients, and we've talked to the insurance company that we're collaborating, and everything is fine. Everything's okay to do that. I also go to Council on Aging, senior community senior centers, and which is a great place because there's a huge amount of time where people are living on their own and they're retired and they cannot afford to go to the dentist anymore, and they want to take care of themselves. They have bought into getting the crowns and the partials and the bridges and everything, and then they get to the point where they just need to maintain some stuff and they can't afford it because the dentist wants $178 to clean their teeth, and they can't. So I go to the Council on Aging and I set up, and they're so super grateful. And for those people, I really reduce my charge, and I get them to pay me cash. So, and then I do some stuff at the schools, which is exhausting, but I love it. And for those patients, I either do Mass Health billing, or if they have no insurance, then I don't charge them. And if they have private insurance, I will put fluoride on the child and do a screening at no charge. And of course, everybody gets toys and pencils and all that stuff, so they love it. But I think that that's fair, because if it's called the working poor, and you have 3 kids and you want to put sealants on those kids, but they're $53 a piece at a dentist's office. People cannot afford that. The dentists have made it so unaffordable for the average person to maintain their oral health, and somewhere people need help. Now, I can't solve all the problems, but I do what I can. I'm not going to make $1 million, and I don't really care if I make $1 million. That's not the intention. The intention is to be able to support myself, but also to continue and maintain a program. And you can't do that if you're not getting some type of reimbursements on a regular basis.
Sure.
So
Jolene,
I get my income from all different ways. There's private fees, there's Medicare, there's private insurance, there's no no reimbursement, all different ways.
and I think probably everybody has to be open to the fact that you can't pick one model and make it work the way you want.
I don't think though. I don't think so.
Yeah. Jillian, I was going to, again, just to kind of finish up on that, on the going into a corporate setting. How do you do that? I mean, do you just take a look at an office somewhere, go knock on the door, or how do you start?
Yeah, I just got a few leads from friends, but also partnering with another company that, like Flossbar, that's their focus. They don't have the equipment, and they do have a dentist to work with, so that was nice. And they had done the marketing part of it, and I was supplying the clinical and the equipment part of it, but then also reaching out to local corporations in my area, and I'm just venturing into that now. So I hope that we will be successful and, be able to grow that side of the business as well.
I think it's, especially, and again, I did actually a webinar with Eva from Flossbar last week. So
yeah, I was on that.
We talked about it a little bit, and it really is an area that, she focuses on the typically self-insured, which just means the employer is paying their dental themselves. They're not working with an insurance company and paying monthly premiums. And so that something like this is nice because, they can pay for everything or whatever they're going to do. Other companies that we work with that have a similar model, like going to insured, companies that have, Guardian or something like that, that have 100% coverage for preventive and diagnostic, so that they know that everything is paid for. They do have to do the billing, but they know that everything's paid for, so they don't have to worry about collecting. As long as the person's eligible, they don't have to worry about collecting copays and so forth on the site. All they have to. So
and Bill, there's a bit of a challenge. This is Joan. A bit of a challenge with direct reimbursement to hygienists from third-party payers. So, I think it's as Kathy was saying, you try and find all different kinds of resources. It would be working through your supervising dentist or an associate dentist or a partnership dentist, so that you can access the funding in certain areas that you're not able to do that.
Yep. Well, look, we're kind of running out of time. I could keep going for another half hour easily, and I don't want to bore people to death with because I'm curious, but I do want to end up with just talking about mentoring and where does somebody go? I was not able to respond, partly because I took a vacation, but I was not able to respond to all the emails I got asking specific questions about specific the dental laws of every state about the hygienist, and the answer is always going to be the same. I don't know. Please talk to somebody locally. But just generally speaking, where does somebody go for mentorship? Just in a quick summary, Kathy, if somebody called you and said, I want to do this, where do I go to find out how to take some next steps? Is there a mentorship program, or what would you advise?
I would advise people to go to their state ADHA. They're going to be the ones that are the most up to date with their state laws. And for instance, in Massachusetts, we have an Office of Oral Health, which is a state designated. It's under the Department of Public Health. And there is someone who works there. She's actually a hygienist, and she knows all the public health dental hygienists. So she would be able to network for you and get you in touch with a public health hygienist if you wanted to have a conversation with one of us. And that's Massachusetts. But I would say your ADHA, or look and see if there's an Office of Oral Health within your state.
Great, thanks. Jolene?
For myself, I agree with ADHA, that through our association, I professionally help mentor. I also am connected with the local college, St. Pete College, and they have a track with public health. And so I work with students on that, and it's fun because they get to see what I do, and it's, you know, outside the box. And I also go, that's for the bachelor degree program. And then I, through the community dental health, will do some speaking to the associate degree. And then occasionally, like I just finished up with a student that was getting her master's degree, and she had been working in senior care facilities. And so we just, you know, she was helping me, I was helping her, and it's kind of a mutual thing, but mentorship worked well. I also, again, another plug for the American Mobile IntelliDentistry Alliance, because I feel like I've learned so much by being a member of them. If people are a student, I think it's free for students to be members of there, and we are growing, and we have committees, and we have programs, you know, CE programs, and monthly different meetings that you can learn from people that are in the business as well. So I feel like there's a lot of different opportunities for mentorship.
That's great. I second on the AMTA. I think they're a great organization. Joan, any final thoughts?
Second on ADHA, AMTA, but also looking outside of the box, as we will, or outside of dentistry, for mentors within the business community. I work with coaches at the Small Business Development Corporation, which is in alliance with Small Business Administration. So there's that. There's the SCORE coaches and other leadership coaches. I'm now working with Kelly Tanner, a PhD, with her organization called Next Level Dental Hygiene. So I think it's just really being open and growing each and every day, being committed to things like research, working with students, supporting the industries that you're in, even your local industries. I think we talked about this before, networking with local groups that can help you learn about that population you're working with, and the support that we need there and that you need.
Well, that's great. So Daniel, I'm going to open it up to questions and see what might have come in.
Okay, we got a few questions here. So first question was about the Clear membership plan, Joan. Just wanting to know if it's a national service and just a little bit more about that.
Well, I think you could probably go on to clear.com, KLEER.com. I hope that's what it is. I didn't write that down.
That's what
and
it is,
learn,
yes.
Is that what it is? Okay, and learn about their program. But basically, it's for the non-insured person, to give them an option to pay a fee, you know, and you decide what it is that you're going to offer for your fees. It's very much custom designed for what you do, what you deliver.
And I would add, one of the big benefits of a program like that, they're not the only ones, but they are
Right,
good.
they're not the only ones,
yeah.
correct, yeah.
But the big value of it is they bill the patient on a monthly basis, or annual, if it's going to be annual. And so you don't have to worry about collecting it. And if they fall behind because they didn't make a payment, that they'll handle that. You don't have to worry about the fact that somebody missed their monthly payment. Now you do, I will caution just in advance, it's not an insurance program. They're not paying a premium. They are paying for work that will be rendered. So that if they choose to pay $100 a year, I'm making a number up, $100 a year, you've got to show that you, in fact, gave them $100 worth of services. Now you can price it however you want. You can put whatever program together, but it is dollar for dollar. It's not a matter of somebody wins and somebody loses if they don't spend all their money by the the end of the year, you don't get to keep what they didn't spend. And so,
Right.
you know, so there's.
It's a
just
true
some-
partnership for sure. And
Yeah.
also to have the software that I have with Teledentix, which would allow me to do a grouping and code it out, you know, because you don't want to be doing something that you're not doing and not able to quantify
Right.
that you're supporting the person that has this model. But it's all about integration and everything working together and kind of you're right, saving yourself some
Yeah. No, it's,
headaches.
yeah, no, it's, if you want to run that kind of program, you need that kind of software, just so you know. Anything else,
Okay.
Dan?
Yeah, we got another one in here. So have any of you considered creating a nonprofit extension of your business?
This is Joan. Yes, I have. When I first started the business name, when I bought my domains, I bought oralhealthcareathome.org. And so I come actually from the membership side of nonprofits, the 501c6, but I also know what's involved because I work very closely with a nonprofit development group. So that's a big step though. And I have met some other people that are doing that type of work, but you've got to really make sure if you're starting a nonprofit, that is actually much more difficult, believe it or not, than starting a business because you have to have a fully functioning board of directors and making sure that you're following all of the laws around starting a nonprofit. So I haven't done it yet, but I did intend. I do intend at some point too, yeah.
I do know that some people have part of their business as for-profit and part of it not-for-profit. Not-for-profit does not mean you don't make a profit. It's a tax identification, and to get the 501c, I know, you know, you need to really do that with an attorney, I believe. And to get a 50
team too, Kathy.
yeah,
you know, it's
and
very difficult to do that on your own.
And it's difficult to get that designation. But should you do that, I do know that if you have a 501c, it's easier for companies to make donations to you. So if when I first started out and I was asking for donations from, like, just say Colgate, for instance, they wanted your 501c, and there's money there for them to donate. It's a percentage thing. I'm sure it's some type of a tax write-off, but you need a 501c, which I didn't have. So I'm a private business, and so but you know, that's a long road to toe, but I think it might be profitable.
Jolene, any thoughts? Jolene, any thoughts from you on
Yeah,
nonprofit?
I like the idea. I explored it slightly. I also had a SBA mentor, and we talked about that, but we started with the for-profit section. My accountant bookkeeper is actually a nonprofit accountant bookkeeper, which is nice. And I've looked at grants, so I feel like there is money out there. And now that I'm in business and more up and running, I feel like it would be a great idea because I have a lot of patients that just, no matter how I look at it, they can't really afford it. And I would like to have that entity of my business to really be able to give services away even more for free.
Just a note, you don't need to be a 501c to get a grant.
Oh, well, there's probably some out there. I just haven't seen them.
Yeah, a donation is typically you need a 501c, but for a grant, you do not need to be nonprofit. I just received a grant from Mass Health or Medicaid for equipment and you have to meet the criteria, which was for people that are on Medicaid and may not speak English, and maybe I think it was also for disabled. So depending on what the grant is, if you can fulfill that grant, you're welcome to apply for it. You don't have to be, and it is non-taxable. Grant money is non-taxable, which is nice,
Good.
but you don't need to be a 501c.
Okay.
Great. All right. Well, so last question here. I know we're coming up on time, and it's about marketing your practice or marketing your services. You know, some of the marketing stuff that you can do is probably more on a qualitative measurement where you're not actually getting, you know, the exact ROI on what you're spending on marketing materials. But Jolene, I noticed in your photos you had the banners and everything printed off. What's the value of that, and why did you decide to do that, and why should other people consider making banners and marketing materials for their practice?
Actually, it's twofold. So part of that is for marketing, but I realized in setting up the corporate dentistry, I wasn't comfortable with the setting, but I was into it and I couldn't make changes there. So I'm going to use them as HIPAA barriers in between my setups for my patients. I just feel better about, you know, being as compliant as I can, but I like them. So they're kind of marketing as well. If I go into a facility and I'm going to teach like the CNA staff oral care, and, you know, I've got something marketing my business, and, you know, so I can use it for marketing, doing presentations, but also use it as HIPAA barriers with my patients.
Got it. Kathy, Joan, do you guys do anything like that as well?
I have some marketing material. I do have a logo that I had created, and I have some visuals. But marketing, and interesting. I just took a course this past week at a retreat on using Instagram. Which I basically would hire a Gen Zer to do. It was amazing to listen to how that's done. And I can see that that's going to be happening because I think it's the millennials that are going to be taking care of their boomer parents. That's what's going to be next. And so we're going to need to know how to communicate with them. So I think it's being open to other ways of marketing and getting the information out there so that people can be drawn to you. So far for me, the thing that has worked best for me has been word of mouth.
For me, I think it's definitely word of mouth. I also have a name. I have people call me more now than me going out looking for business. But initially, what I would suggest, and probably because I don't know how to use social media as well as I should, but sometimes the populations that I'm serving, social media is not, it's not on their radar. So just going, if you make more money when you see people that are collectively in a group, so say at assisted living or a nursing home or whatnot, as opposed to going from house to house to house. Okay. If you're going from house to house to house, you've got to charge a house call, because you can't just charge for the pro fee. And if people are willing to do that and pay for a house call, it's fantastic. But if you're looking to go to someplace like a facility, I guess I would say, again, get business cards printed, and maybe bring some, you know, nice wrap cookies or something like that, just like people do when they come to the dentist's office, these salespeople, and go in and introduce yourself and talk to the director of nursing, or talk to the director of the nursing home, or talk to, you know, and go in and say hi and just introduce yourself and let you know, this is what my services are, and let me know how I can fit in and service your patients here or your families.
Wouldn't you all agree, though, that you do need an online presence, a website?
Yeah.
Oh, yes. So I have a website.
Yeah.
Yes.
I have a
probably
website and LinkedIn and Facebook,
LinkedIn.
and it's
Yep.
the social media part. I'm just starting to build that and navigate into those waters. I'm doing it myself, so I don't know how
Yeah.
well, but I have advice from people, which is great. But it's interesting. Also on the business card, because of the focus of my initial population, it's a postcard, so it's bigger and it has more on there, like my services. And then on the back side, it has room for the date for their appointment and everything. And I'll write it in a Sharpie, so it's big and, you know, something they could put on the refrigerator, but it's a piece of marketing material, not just a regular business card.
I have a
Idea.
website, but honestly, I don't get, you know, and you can actually link in, click on that and sign up on a patient portal through my website. But I don't, it's not used very much. I maintain it still, but it's not used as much.
I think that's a future thing, Kathy. It's good to put it as a foundation. And I think as things move on, more and more people are going to be utilizing that to make appointments and
Maybe.
working digitally. I don't
Depends
see it
on your
happen. It doesn't happen
population.
with me right now, exactly. But I
I
think
think it
that
depends on your you know, you have to kind of think of this as individual patients that you know, like you would see in a dental office, or are you talking about group populations? And I mostly deal with group populations.
Okay.
and I do home in-home care. So the area that I'm looking at for developing that model, because it is extremely difficult to develop that from the ground up, is more in part looking at partnershiping with other home health agencies and home care,
Yep, right.
other therapist agencies, people that
Yep.
have a ready-made patient
Inroads.
list and
Yep.
roads, and you can work into it, because it's very difficult to manage in the beginning. And that's not to say don't do that. I wouldn't
Right.
say that, right? But I would say that don't expect that to bring a big return until you get some volume and you can assign people to go. You might want to start that with keeping it in a smaller area so that you're not, spending, but you're going to spend a significant amount of time going from house to house.
I would also suggest that maybe you talk to social workers, because they often are a one-on-one with people in their homes. And I do get a lot of call from, oh, I was referred by such and such social worker, whether they're in a hospital setting or they're in the town setting. Every town has social worker for seniors or whatever. So
Bill and Daniel, one thing I wanted to mention that I wrote down was that ADHA had produced an environmental scan. I think that was back in 2011. And I think it's always really important to look at your demographics. And one of the most recent, when you're in business, and one of the most recent studies I saw, and I think it came out of the Health Policy Institute, and maybe DHHS, but dentistry is only accessing about a third of our population in the country. So we're seeing maybe 100 million people. There are 200 million people that are not being served. And so I really think that there's so many partnerships and models and different things that we can be developing to bring dental care and the dental industry to all of the people in our country. And I'm really thrilled about working with all of you. This has been a fantastic opportunity.
Well, thanks. And I'm going to use that to wrap it up. You just opened up a topic we could have a whole other webinar on. And that's,
Right.
you touched on it earlier too. And that is at the end of the day, it's the financing of this. And how does that all work? And how does it get paid for? And you mentioned earlier that, all the savings in the healthcare system, if the person happens to have a healthy mouth, especially with chronically ill patients. And no one's figured that one out yet. I shouldn't say no one. People are around,
Small group of people.
Yeah, a small group of people are biting at the corners, and that's about what we're getting. But it's happening, and it's going to move. And I think seeing hygienists in medical facilities is going to be common in another 10 years if my crystal ball
Absolutely.
is right. And that's going to have created that medical dental integration. But it's going to take some time. There's more than one barrier to knock down there before it gets there, but we're headed in that direction. Okay, so again, at the risk of boring people and keeping them on too long, I really have to thank you. This has really been a wonderful series. I know the feedback is going to continue to be good, and it's going to be out there for other people to hear too. But just thank you so much, and I look forward to working with you all.
Thank
So-
you. It's been a pleasure.
Thank you so
Um,
much.
Learned a
Great.
lot myself from Kathy and Joan and Felicia that
Same
were on
here.
here. And thank you
Same
for all
here.
sharing all your pearls of wisdom.
Absolutely.